Okay, so we are paramedics and we arrived at the scene of accident within like 2 minutes, and the surrounding is safety, PPE, we already wear, and then the responsiveness of the patient. Patient, can you hear me?
Yes.
Yeah. Okay, so patient is having like a external hemorrhage in the right leg, and and then after that, because there's the external hemorrhages, so immediate compression and tourniquet should be applied very fast. Tourniquet, then wait.
Compression.
So compression, also compression. This one is the femoral artery. I'll put a clot and I'll compress.
Now I'm going to do it.
Okay, so the pulse is not filled and then the hemorrhage stops. And after that, we are doing aseptic dressing and covering the wound with a bandage. Aseptic. Okay, so there's a open fracture scene here.
So I'm now covering the open fracture with bandage.
And adhesive strips is also used, avoiding the wound area here. Well, one paramedic is doing the bandages, another paramedic now is obtaining the circulation, airway, breathing and circulation. Airway. So the airway is intact, and for B, breathing, breathe quite quiet. The breathing is fast, is 26 breaths per minute, and then also for the circulation, patient is having tachycardia 120 beats per minute, and the skin is slightly pale color, but it's not as pale as before. And after that, we are doing neurological examination. The dilations of the pupil is equal, and also eye opening is spontaneously. I'll give a 4-point, and then verbal response. Patient, do you know who are you?
Yes.
What is your name? Do you know where are you?
Yes.
Do you know what is happening?
Yes.
Do you know?
Yes.
And also the verbal response is orientated and converses. I'll give a 5-point. And also the motor response. Can you raise your right hand? Can you raise your left hand? Okay, and then the motor response is obey. Can you raise up both of your hands and stay for few seconds? Okay, thank you. And also for the left leg, can you raise up a bit? Okay. And lateral weakness is normal, so I'll give 15 points for Glasgow coma skill. And after that, hit to toe. Okay. So after that, I'll do head to toe examination. So for the head examination, there's no sign of trauma. There's bruise is absent. The shape of skull is intact. There's absence of wound, and then there's also no fracture here. As well for the neck. There's no bulging of vein. There's no bruise. The shape is intact, and there's wound is also absent. Okay, so now I'll be doing for the chest. for the clavicle and each rib. So the chest, the ribs are intact. There's no fracture opening happening here. Absence of bruise. The shape is also intact. There's no signs of trauma. There's no other sounds heard here. So there's no hemothorax, sorry. No hemothorax and also no pneumothorax. As well as for the abdomen, during inspection, there's no signs of trauma. There's no bruise. The shape is intact. And then, do you feel any pain?
No.
No pain? Do you feel any pain?
No.
Do you feel any pain?
No.
Do you feel any pain? Okay, so among palpation, there's no pain. There's no sign of trauma. As well as for the pelvic. The pelvic, they are intact. There's no trauma. The shape is also intact. And for the upper extremities, upon inspection, there's no bruise, there's no pain, there's no wound, there's no cuts. And then, do you feel any pain while I was palpating? The pulse is present in both hands. There's no pain while palpating. As well as for the lower extremities, I will avoid this part. So for the left extremities, there's no wound, there's no scars. The pulse, they are present. There's no swelling, no hyperemia. The temperature is normal. Can you please move your toes, both toes? Okay, yes. So, okay. So the sensitivity is normal and active movement is present, as well as the right lower extremities.
Вы долго еще будете заниматься? Сколько минут?
Один час.
Хорошо. Когда закончите, ключ двери закроете и...
Хорошо. Хорошо. Спасибо. And then for the right extremities, before closing with the wound, we observe there's an open fracture here, and the pulse is absent because we apply tourniquet, and the open fracture is present on the middle third of the right leg, and there's swelling happening here, and the temperature is slightly lower. The sensitivity does not decrease. Sensitivity is also present here, and the patient feels pains.
Okay, so for the conclusion, the patient has tachypnea, tachycardia, and hypertension. Patient does have an open fracture on the right leg that we have seen before the bandaging, and the pulse of the right leg of the dorsa pedalis and tibialis posterior pulse are absent. There are also cyanosis of the leg, and so for conclusion, I think patient is undergoing traumatic shock, and so what we will give is we will give IV infusion for the patient, and then tourniquet is also removed after each 30 minutes for and a 10 minutes rest by compressing the femoral artery pulse. Yeah. And also lastly, splint is used to fix the fracture position. So thank you for sharing that. Okay. And then a string is used to fix the string. Okay. Something like that. It's used to fix the spleen. And then patient is also given analgesic drug such as morphine by IV infusion to relieve the pain for the patient.
Transfer to emergency department distraction.
After we arrive to the hospital, the patient is transferred to the emergency department with a stretcher. Yeah, and that's all. Thank you.